We're recording. So welcome to week 5. You made it. If everybody could turn their cameras on, that'd be fantastic. Okay, so this week I sent out a couple of announcements. You got your group projects, right? And the goal of your group project is for somebody to take the lead and reach out to everybody if you already haven't done so, and figure out who's going to do what part of the assignment, right? And then somebody needs to offer to put everything together. Please don't submit to me your part. This all needs to go back to the group and go together into one paper or one project. And then you submit that through the discussion post. This is a discussion post assignment. Okay. As far as submitting it, if you want to put it together in a Word document and submit it as an attachment to the discussion post, that's fine. If you want to copy and paste it and put it into the discussion thread, that's fine. Okay, it just needs to be the whole project, not individual parts. Okay, so I fully acknowledge that I'll be looking at, 4 of the same projects, but everybody has to submit. Okay, if a submission enters it into the grade book. All right, so it's just not one person submitting, it's everybody. Okay, does anybody have any questions about that? Because I've already gotten questions regarding this assignment. It is not a PowerPoint assignment. Your PowerPoint assignment is your week 10 vulnerable populations. Okay, this is a paper. All right. Does anybody have any questions about that?
Yes.
Yes, go ahead.
I don't know how to connect with any of my group members because you didn't list any contact or anything.
In your what am I trying to say, shell, you have the emails of your teammates, correct?
Oh, I didn't know that. Let me check. Okay.
Get away with a great deal.
Okay, so you have all that information.
Does everybody have their emails in their name? Because I know some people use different names for emails.
Who is it? Do you want to reach out to your group now? Who's in your group?
If you go to the inbox and they ask what class you in, a list of the teacher and who's in the class. If you go to the inbox and you're looking for somebody, yep, you will see the list.
With contact numbers?
It just have an email, so you can message everybody from the inbox.
Oh, okay.
If you want on Canvas.
All right.
Thank you, Whitney.
Thank you.
And also remember that this project is due on this paper is due on that Wednesday of week 7. Okay, and that's in the guidelines. It's due on Wednesday, so that you have until Sunday to do 2 responses, peer responses to 2 other projects.
Okay?
So I'm confused. We're gonna post our paper on a Wednesday, and then we have to do peer responses for two of the other papers that are posted.
Yeah, just like a discussion question.
Okay. I just wasn't sure.
Yeah, it's in the guidelines. I'm just reviewing the guidelines.
Okay, thank you.
Yeah, and then I think somewhere there's no peer reviews. Okay, I'm asking you to do peer responses like you would do discussion questions. The guidelines have a peer review in it, like evaluating your group. We're not doing that.
Okay.
Okay.
No problem. And Tiffany, just while you're on, I did send an email out to our group. So if you just want to take a look at the email, I know, and we'll figure it out from there.
Got it.
Okay.
Professor,
Tiffany,
I
yep.
just wanted to make sure, you saying that it's due on week 7, because on the syllabus it says week 6,
The group project?
if I'm not mistaken.
Let me take a look.
Yeah, I'm pretty
might
sure
be
it does
wrong.
say week 6.
Right. So I just want to make sure.
Hang on a second. Let me have a look. On the syllabus, it says week 7. It's the same week as your second exam. I'm looking at the syllabus now. You guys, Tiffany, you want to double check that? You should have the same. Guys, look at the syllabus and make sure we're working off the same syllabus.
I'm gonna look really quick too. Sorry.
Anybody wants to take a peek and just confirm with me that it's on week 7. Or we can make it week 6 if you guys want, but here,
You
I'll
are
bring.
correct, Professor.
Pardon
I
me?
see week 7
You're
too.
correct.
Okay, it's week 7. Okay,
It's
all right.
7, yeah.
Yes, ma'am.
Okay.
I think we were getting confused with another class potentially.
Oh, okay. All right. Okay. So let's focus on today. So today we're going to cover week 4 material from last week, the notes, and we'll cover week 5. And it's helpful if you can to pull up the blueprint notes that I sent, because that's my outline for lecture. And so we go through those. So it's good to take notes on those if you want to. I'm hoping to have the study guide, the blueprint study guide for the concepts ready to you this weekend. That's my goal. I will have it to you by the weekend. And then next week is review week, right? We have the three review sessions, Wednesday, Thursday, and Sunday, right? So pull up that master calendar and take a look at the times, okay? And then the following week is your exam. Okay, just kind of doing a review of the next couple of weeks. Is everybody working on their HESI prep assignment? Because there's a lot you can fill out in that now, and especially after today. So I highly encourage you in the next week or so to stop and update that. Stop and update that for all the topics we've covered, because it's going to get to be a really big assignment in week 8 or week 9 when it's due, if it's not filled out. Right? You're going to have to remember the weeks that we went over certain topics. This is going to take a lot of legwork. So I really encourage you to stop after this class, or maybe even after next class, because next week is week 6, and that's the end of content for exam 2. Okay, so at least by the end of next week, stop and start filling that out, or continue to fill that out. Let's see, Jasmine, are you getting settled somewhere?
Yes.
Okay. Okay. All right. So does anybody have any questions
I'm
on
still trying
anything?
I'm still trying to access, what she just said. Did you say go to people? Because I click on people.
Go to
Yes,
inbox. Whitney,
inbox.
Whitney, go ahead.
Yeah, like where you on the side where you see like announcements and the list of things, they'll say inbox. Like,
Okay.
and then you click on inbox and then you act like you're trying to send a message. They'll ask what class. And then you look under this class and then they'll give you a list of everyone in the class.
Okay, let's get go. Oh, okay. Did you get that?
I'm in inbox, but you can go ahead. I'll just keep looking.
Okay. And if everybody, let's see, I can't, Sabritra, I'm looking at your ceiling. Davika, I'm kind of looking at your ceiling. Okay. All right, let's do some content. I'm gonna share my screen with you guys. Okay, can everybody see my screen? Yes?
Yep.
Okay, so we're talking about vulnerable populations in week 4, and we're particularly talking about special vulnerable populations, which include pregnant adolescents, LGBTQ community, mental illness, and alcohol, tobacco, and other drug problems. So I don't know if you've had a chance to pull this up or review it, but this is what I will be covering. Please don't forget about your, I mean, you have your book readings here, right? You got your book readings, but you also have your Canvas course readings. Okay? You have your Canvas course readings. And this week, or for week 4, there's a course reading on pregnant adolescents, LGBTQ, and mental illness. So please be sure you read these in addition to your book reading, in addition to these notes. Okay? So what, I'm sorry, hang on 1 second. 1 second. Sorry about that. So let's see. Let me share again. So what do we know about vulnerable populations in general, especially the special vulnerable populations? Very poor health outcomes, right? Why? What do you think's going on? I'm asking you guys.
Poverty,
Poverty, absolutely.
homelessness,
Mm-hmm.
Language barriers.
Language barriers. Yep. What else?
Or access to health systems.
Less access.
Less access.
Yep. Yep. Chronic illness. Right? Mental illness, substance abuse, TB, hepatitis, STDs. Okay, let's talk about pregnant adolescents. When you think about pregnant adolescents, what concerns do you have? What's going on with this group? Why are they labeled a special vulnerable population?
A lot of them don't finish school.
They don't finish school. Excellent. Yep. What else?
might not have a support system,
Mm-hmm.
won't go and get health care until it's too late because they're in denial.
Yeah. Won't tell anybody. Yeah. What else?
They can be
Abuse,
homeless.
trauma,
Homeless. Mm-hmm.
being
They're
abused.
not eating right.
Mhm.
Yeah. Violence. Violence is very prevalent in teenage pregnancies. Okay, so we do know that there's a direct correlation between poverty and poor health outcomes, right? We're clear about that at this point, right? It was mentioned about dropping out of school. Poor teens are 3 times more as likely to drop out of school. Okay. And it is proven that when programs and resources are in place to keep these kids in school, they do better. Okay, chances are increased for a better future. improved healthcare access over the long term. All right, so it's critical to one of the most important interventions for this group is to keep them in school, okay, and have them return to school as soon as possible. Okay. It is important for nutrition, obviously. It's important for prenatal visits. It's important for support systems. But most importantly, it's to try and keep them in school. Okay. And then what happens if you have a pregnant homeless teen? Okay. Higher rates of STDs, increased risks of drugs and alcohol, poor nutritional status, and high risk of adverse birth outcomes, right? We know that racial and ethnic minority groups have higher rates of teen pregnancy because higher rates of poverty exist, lack of educational opportunities, higher rates of abuse and violence, sexual victimization, right? Factors that potentially contribute to teen pregnancy: low income, lack of education, lack of social support, maybe their living environment, what they're exposed to, abuse, trauma, neglect. Okay. Teens who get caught in, teens who are pregnant are often caught in that cycle of poverty, right? And school failure is more likely to increase their risk of homelessness. And like I said, they're much more likely to experience violence during their pregnancies. So let's play this out into the clinical part. You're doing a home visit with a new mom who is a teen. What are some important things that you think you would be observing for? Because obviously this is a high risk group and now they have a baby. What are you going to be observing for?
Could it be postpartum depression?
Could be observing for signs of postpartum depression. Absolutely. What else?
Making sure that the mother knows how herself and the baby are supposed to be developing.
Mm-hmm.
Making sure that the mom is bonding with the baby.
Yep. That's the biggest. And what does that include? Eye contact, responding to the baby's needs, crying, diaper changes, right?
Yeah.
That's one of the most important observations that we make as nurses in that postpartum setting, is that the mother, like Tamara said, understands the growth and development of this baby and the bonding. Okay. Let's go through some primary, secondary, and tertiary prevention strategies for this group. Okay, so remember, primary prevention, we're trying to prevent a pregnancy. Okay, maybe some strategies are developmentally appropriate sex education, and it begins early. Sooner these conversations happen, the lower the risk of an unintended pregnancy. Okay.
Mhm.
Parents should be educated on their necessity to provide these discussions with their kids at home, right? And early on. Education should include reproductive rights, where to find contraception. Okay, so those are all preventative. Okay, secondary, we have now screened and identified who our population is that may be at high risk for a teen pregnancy. Maybe they have a history of substance abuse, history of sexual, physical, or emotional abuse. They live in poverty, mental illness, screening for vulnerable women, right? At that point, we can provide pregnancy testing, STI screening, contraception, right? Remember, they're at risk, early identification, early intervention. Okay. Tertiary. So at this point, they're pregnant. Okay. So this point they're pregnant, we would have to start to identify what their needs are.
Mhm.
Okay. Do they have adequate nutrition? Do they have prenatal care? Okay. So most importantly, getting this teen back into school is the most important thing with teen pregnancies. Okay. We talked about bonding. Okay. Any questions about pregnant adolescents? Very, very high risk group. Anybody ever worked with teens who are pregnant?
I work at a OB-GYN and we have a lot of teens who come
Mhm.
through here that are pregnant that
Mhm.
I happen to know from when I worked in the school system.
Mm-hmm, mm-hmm. And is this what what we just talked about? How accurate is that?
Very,
Yeah,
because a lot of them drop out if they don't have, if they're like mother or have a support system that's involved.
right.
It pushes them to keep going.
Mm-hmm. And a lot of pregnant teens don't even access care until their second, sometimes third trimester.
hmm That happens, but a lot of women, period, don't,
Oh yeah, yeah.
but teens especially.
Mm-hmm. Mm-hmm. And then please read that course module sheet on teen pregnancy as well as LGBT. So with regards to LGBT population, okay, we as nurses have an ethical obligation to provide culturally competent care to LGBT families. And I'm going to step back because we take an oath to provide culturally competent care, right? To everybody. What is culturally competent care?
Be sensitive to other people's culture
Mm-hmm.
and respect each person based on their culture, belief, and values.
Culturally competent care is going to follow us along in our nursing profession the whole way. Okay, we are going to be working with clients from many, many different cultures over our career. All right, it is our obligation to be as culturally competent in caring for these clients, and that includes LGBT families. Okay, some nurses may feel a degree of discomfort discussing sexual orientation with their clients. Okay, it's important though for us to overcome our barriers. When we're working with this population, we need to check our own beliefs and values and maybe prejudices or whatever. And we have to be able to work sensitively, well, that's not even a word, have to be able to work with this population with compassion. Okay, understanding our own feelings with regards to the population is critical. Okay, and one of the most important things is, as nurses, it's really important to provide a comfortable and a safe environment for this group to discuss their sexual orientation. Okay.
Okay.
So, for example, taking an open, non-judgmental history, social sexual history, is the key to building trust. First and foremost, we need to build trust. And that really goes with any vulnerable population. Okay, the very first thing in building our relationship with clients is to establish trust. Right? The way you establish trust, we don't make assumptions, we're non-judgmental. Okay, we ask open-ended questions. Okay, so for this particular group, maybe instead of asking, are you married? Maybe we ask, do you have a partner? Okay, what do you call your partner? The goal is to be very culturally sensitive. Okay, so these kinds of questions, open-ended, and we're just not making assumptions. Okay. The other thing I want you to know about this population is the CDC has recommendations for screenings, okay, for the prevention of STDs, okay, for this population, okay, and here they are right here. Okay, and you need to be aware of these. Okay, these are your annual screening recommendations. Okay, screening for HIV, genital herpes, syphilis, gonorrhea, and chlamydia. Okay, and they suggest that the recommended screening interval is shortened to 3 to 6 months for those particularly at high risk. And particularly at high risk would be individuals with multiple or anonymous sexual partners, or those who may use illicit drugs in conjunction with sex. Okay?
Okay.
So that's what we want to know about that population, the LGBTQ population. Okay? Mental illness is our next topic. Wow, have you guys seen an increase in mental illnesses in the last couple of years? It seems to be exploding. Why do we think that is?
COVID.
Post-COVID,
High level of stress.
high levels of stress, economic struggles,
Mhm.
right? We
Yeah,
know
I
that
was gonna say like just the cost of living in general going up too and is causing everybody stress.
mhm, mhm. We know
And I
that
feel like you find more people that did not have mental illnesses that are now coming forward with mental illness situations.
yeah, and I saw it in the schools the last couple of years I was in the schools. I was in the schools pre during COVID and post for a little bit. And the amount of mental illnesses in kids was skyrocketing from all the challenges through COVID, isolation, right? The lack of socialization during that time. We know that anxiety is a common emotion. Okay. It is considered normal and healthy unless it becomes so debilitating that it impairs your ability to function. Okay. Abnormal or debilitating anxiety sometimes can be life-threatening to individuals, right? Interestingly, there's a 30% hereditary associated with general anxiety disorder, and we'll talk about that in a minute, right? We're at risk for anxiety disorders because of numerous things: physical, psychosocial, developmental, cultural, spiritual things that impact our lives, right? And then we know that people with anxiety disorders may have other mental disorders, have other comorbidities, maybe a major depressive disorder or substance abuse. Okay, there's four conditions that I would like you to know about. One is general anxiety disorder. The second one is phobia. Third one is OCD. And the fourth one is PTSD. Okay, so there's information on each of them. I just want to go through each of them briefly. General anxiety disorder, GAD. Okay. This person experiences persistent, unrealistic, or excessive worry about two or more life circumstances for at least 6 months. Okay. Phobia. What's a phobia? Experiences excessive, irrational fear of a specific activity, situation, or objects. This fear can lead to extreme anxiety that interferes with normal responsibilities. For example, I have a phobia with snakes. I just do. Okay, I fit that definition perfectly with regards to snakes. Okay,
Mine is spiders. I've
spiders.
almost crashed a car because a
Spiders.
spider was inside my car and I had to get away from it.
Mhm. Right. So common phobias may include fear of heights, spiders, enclosed spaces, claustrophobia, right? And phobias tend to run in families. Isn't that interesting? Then you have OCD, obsession, recurrent or intrusive thoughts that you cannot stop thinking about. Then these thoughts create anxiety, right? A compulsive act is an act that a person feels compelled to perform. Okay. Here's an example. A person with extreme anxiety begins performing repetitive, say, hand washing in an attempt to reduce that anxiety. Okay. And then you have PTSD. Okay. It's some kind of a previous event that's involved, maybe a close near death, threatened death, serious injury. Maybe it's a car accident, witnessing car accident. There's lots and lots of things that can cause PTSD, right? The person may experience fear, helplessness, horror, the remembrance of such events. Produce feelings. Does somebody need to mute for background noise? Please. Hey.
Yep, it'll be fun. Bye-bye now.
I
Okay.
love her.
Oh, that's Tamara. Oh, okay.
Turn back.
No worries. So just the last part about PTSD. Okay, maybe nightmares, maybe flashbacks. Okay, it can be a very debilitating disorder. Very debilitating. The other thing with regards to mental illness is children. Children are at the highest risk for mental disorders. Okay. Poverty, witnessing violence, being victimized themselves, abuse, neglect. Okay. And then the one medication I want to mention that I'd like you to be aware of is lithium. Lithium is used to as a mood stabilizer to treat bipolar. And some important teaching points if you're working with a client that is on lithium. Encouraging normal salt intake is important, and reporting any symptoms like diarrhea, vomiting, tremors, or lack of coordination. Okay, so please be aware of that. Okay, alcohol, tobacco, and other drug problems. Well, we know that substance abuse contributes to a lot of problems in society, do we not? Okay. It contributes to teen pregnancy, HIV, STDs, domestic violence, child abuse, neglect, car crashes, fights, crime, homicide, and suicide, and many more. Okay. We also know that tobacco use contributes to cancer, heart disease, lung disease, emphysema, bronchitis, COPD. Tobacco may also increase the risk of premature birth, low birth weight, stillbirths, infant deaths may be associated with tobacco use. Okay. Here's a list of some definitions with regards to alcohol, tobacco, and substance abuse. Just read through these. You don't need to memorize any of this, but you should be aware. You should be aware of the differences. And here's why. Whatever field of nursing you go into, you are going to be working with clients that have mental illnesses, that have substance abuse issues. So it really is important to have a baseline, at least a baseline knowledge base of the impacts of substance abuse on the client. Okay. So nicotine. We talked about nicotine is a substance that is abused. Vaping. Why is vaping as bad as cigarettes? What particular information about vaping makes it as dangerous?
Is it the
Increase.
chemicals?
The chemicals, the oils.
The nicotine.
It's poisonous. That oil is poisonous to kids, right? Alcohol. A couple of things I want you to know about alcohol is one is how to obtain a blood alcohol concentration level. I want you to understand that that is just not the amount you consume. It has several different factors. Okay, the factors are metabolization. Okay, the rate you're drinking, the rate of absorption. Is there food present? Person's weight, person's sex. You're going to get asked about that. Okay, how do we determine blood alcohol levels? Okay, and what I want you to realize is it's just not one factor. There's numerous factors that go into that. Okay. Lots of different kinds of drugs. We have cocaine, we have amphetamines, methamphetamines. Setting up community-based activities. If you're working in the community, you may be asked to do this. Okay. And so what are some ways we can set up community-based activities aimed at substance abuse prevention? Has anybody ever been involved in that? I used to do this working in the schools with the high school population. Okay. And some of the things that are suggested: increase involvement with pride in school activities, organize student programs, students helping students. Maybe organize the students against drunk drivers. Okay, mobilize and educate the parents. Increase the utilization of recreational facilities. Okay, and this is obviously geared towards the kids. And there's more on that list, but those are things that we can do. Prevention is really important with the young kids. Okay. High risk groups. Okay, groups with the likelihood of adverse health outcomes or at risk of addiction. We see adolescents with experimentation, peer pressure. That's a natural part of development, right? High rates, okay, of alcohol, marijuana, and opiate use, right? We know that heavy drug use interferes with growth and development. There may be comorbidities with regards to, in addition to substance abuse, psychiatric issues, family problems, victimization, genetic predispositions, right? This all contributes to drug use in adolescence. Really big problem. Really, really currently a big problem. Older adults, high rates of alcoholism. Okay. Pregnant women, fear of losing their children, stigmatization, risk of fetal alcohol syndrome, low birth weight babies, right? And then we have the injection, the people who inject drugs, high risk of overdose, contaminated needles, chemical concentration of the drugs. I mean, how many times do we see the accidental fentanyl overdose, mixed with something else? So lots. Okay. Questions about any of those topics? Let's go through this week real quick and then we'll take our quiz. Okay. So week 5. Okay, a bit different shift here. We're going to talk about.
I'm sorry. I have a
Mhm.
question.
Yeah.
What would be secondary prevention for the alcohol and drugs? Well, not
Well,
secondary.
let's think about it. What's secondary
Mhm.
intervention? Early intervention,
Screening.
early identification, early intervention. So what would you do for, let's say,
Um,
high school? So for high school kids, we used to do, well, we had a safe to tell, so kids could report safely, anonymously, their concerns about other kids. So how do we identify people at risk? I would do surveys
mhm.
to students. How do you talk? You know, as the nurse in the school, sit and talk with students, right? If they come into the clinic for whatever, have that discussion with them. So screening them. It's all about screening. It's identifying high risk. What else would you do? Offer a safe space for them to talk.
Mhm.
What else? Does anybody have any other suggestions of what a secondary? How would you screen the at risk? Are you talking about kids
Um,
or just anybody?
yeah, just secondary tobacco screening. I guess it would be.
Yep. So at least what I did in the high schools is offered times to come and talk with, say, a drug counselor anonymously. Did sent out surveys of kids that were at risk for smoking. Then you also look at academics. You know, are these kids in trouble? Are they missing classes? Are they do they just have other things going on that put them at higher risk?
Because at this point, they don't do the drugs or they don't smoke the tobacco yet,
They
right?
they may be starting to dabble in it,
Mm-hmm.
right? They may be, well, two things. They may be at risk and haven't started yet, but they're at risk, or they may
Mm-hmm.
be dabbling in a few things. Maybe they get caught smoking weed outside the school or something. So they're an at-risk group. We want to try and reverse that before it actually gets to, you know, a bigger, when they're actually abusing substances,
Right.
right?
Mm-hmm.
Does that help?
Secondary prevention for drugs use. You can screen for drugs, right? Like you screen a
Yep,
person.
yep. You do drug screenings, yep. Absolutely. I mean, look at the courts order. You know, if they're in trouble, courts will order drug screenings. Even, I don't know that you can order drug screenings. Well, if the court has ordered it, and it's within the school, you do it in the school. Yeah. Screening. Does that make sense?
Yeah.
Okay. Okay, let's move into this week's topics. Whole different shift. Anybody ever worked in hospice before?
Yeah.
Worked with yes, Whitney's shaking her head. Guardian angels, hospice nurses.
Yes, I lost a patient 2 weeks ago. She was on hospice
Oh, I'm
for about
sorry.
6 weeks. Yeah. Thanks.
Yeah, it takes a special kind of person to work at the end with end of life clients, right? So the one thing with regards to hospice is the needs need to be focused on the client, right? I mean, the family is there and we have to help them through it, but our primary focus is the client, right? The goal is to keep the client comfortable, maintain dignity and self-esteem, right? Although one of the goals is to control the pain, it's not necessary to keep the client so sedated that they have no idea what's going on,
Mhm.
right? And that they have no idea what's happening. Okay. Right. We do want the client participating in as many decisions as possible if they're able. Okay, they should be able to interact with their family members and participate in their care decisions. And we know the family needs, like I said, are important, but the client is our most important. Okay, whatever the client, if they have put together a will or health directives, those need to be followed. Okay, so if the client says, I don't want any more tube feedings, I don't want any more, right, Whitney?
Mhm.
Yeah, if the client states what they want, the family cannot override that. Okay? You may have to do some education with the family about why their wishes are not superseding their family member, their friend or relative. Okay? If the client has designated what they want done, that must be honored. First and foremost. Okay, the goal of hospice and palliative care is to alleviate suffering as much as possible, right? Obviously, there's no cure. And that's important to remember, especially for family members. They may have that distortion that this can be cured. It's all gonna go away. They're gonna get better, right? Well, in hospice, there is no cure, right? We are attempting to improve the quality of the remaining life, right? Okay, all aggressive treatments have been stopped. There's no more chemo, there's no more dialysis, no more ventilation, right? The focus becomes quality versus quantity. Okay. In addition to symptom management, we have to also try and assist the families with their psychological and spiritual support. Okay. I mean, what do you do if what does a hospice nurse do if they have family members who, I mean, we have our stages of grief, right? Everybody goes through their stages of grief at different intervals and different times, right? They have family members that are, some are in the acceptance mode and some may still be in the denial mode. Okay, as a hospice nurse, of course, our client is our primary patient, but the family is also a really important part of that care team. Okay. Hospice care typically happens, it can happen in the home, it can happen in long-term care facilities, clinics, hospice centers, the end stage of life. Okay. Typically the prognosis is the patient has less than 6 months to live. Okay. As soon as that is realized by the healthcare team, okay, the case manager will organize the nursing care, the social support, the psychological support, and as importantly, the spiritual support. Okay. Some examples of physical support for the hospice patient: pain reduction or alleviating pain, reducing the air hunger, improving sleep. Social support examples: maybe facilitate relationships that may have been strained or neglected, that the patient wants to mend. Maybe updating a will, saying goodbye. Spiritual support. Some examples: finding peace with whatever your higher power is. Maybe you want to meet with or engage with a chaplain or a spiritual advisor. Okay. And we briefly mentioned the stages of grief. That's important to know when we're talking about death and dying. Okay, this first paragraph here gives some examples of what each of the stages, an example of each of the stage. And you may be seeing different stages between the client, family members, everybody goes along at their own pace. Okay. Autonomy is real important with this population. We don't want to be making decisions for the client. We want to let them make with us making decisions, it removes their autonomy of making decisions for themselves. Okay? We don't want to be, well, there's an example here. Therapeutic communication with this group, asking open-ended questions, avoid making assumptions, avoiding platitudes. Everyone dies, you're not being punished. Oh, I'm sure God will forgive you. Those are not the things you want to say. Okay? It's important. It's an important time with the spiritual work. Patients should be allowed to pursue, communicate, and express their fears and hopes. Right? With regards to pain control, we are not worried about addiction at this point or dependence. Okay? If you're a hospice nurse and the pain control doesn't seem to be working with whatever the physician has ordered, it's okay to call that physician and ask for increased doses. Okay, we're not worried about addiction at that point, right? And then as death becomes imminent, a few things are going on. More time sleeping, appetite fading, oral intake decreases, urine input decreases, right? Vital signs may be affected. Okay. Providing hospice nursing is mentally draining for the nurse. It's important to understand, once again, our own beliefs and attitudes towards end-of-life care. Right? We need to assess those feelings before we would even try to get into this type of nursing. Okay? Really, really a tough but rewarding career. And then on the heels of that, faith and spirituality, right? So back to culturally competent care. Culturally competent care that requires that we have an understanding of our own culture as well, and any biases or stereotypes that we might have, right? We need to approach individuals as unique. We can't make assumptions. Our culture is no more important than others. And with different cultures, we try and incorporate as much of their values and beliefs into the care. Okay? We know that different cultures are maybe past oriented, present oriented, and future oriented. Okay? So if the culture is past oriented with regards to time, they may not be even thinking about the future. Okay, or future goals. Present oriented cultures value the here and now, prioritizing the quality of life and making decisions that make them happy in the present. Okay, so they fail to plan for the future. And then future oriented cultures are more likely to make sacrifices in their present in order to achieve their future long-term goals. Okay, so looking into the future. Okay. Cultural competence requires that we treat each client as if they were unique and gather data on their beliefs and expectations. We do not treat every client the same, nor do we treat them the way we would like to be treated. What if our cultures are vastly different? Right? Right. And it's not sufficient to learn about common beliefs or common beliefs of only the most common minorities. So we don't want to just select a few cultures that we become culturally competent with. These are all cultures. And then finally, cultural competence. How is it finally attained? When the nurse makes a conscious attempt to learn about the people of diverse cultures and try and see the world through their eyes, right? One of the roles in the community that may exist in your congregation or church or wherever you practice your religion, it's she or he is called the faith community nurse. Okay. And this nurse adds the spiritual aspect to the healthcare. Okay. It's a specialized nursing practice, and you're focused on spiritually caring for your congregation. Okay. It incorporates the spirituality into practice. Okay. A lot of the role of this faith nurse: health promotion, health maintenance, maybe grief support. Okay. We know that religious and spiritual beliefs have a significant impact for many people. Okay. And their faith is important as they go through illnesses, acute, chronic illnesses, birth of a child, death of a family member. Right? We know that certain cultures have very strongly held religious and spiritual beliefs. And we need to do our best to try and incorporate those spiritual beliefs into the client's care. Okay. And the last topic to cover is ethics. Ethics is in every part of our lives. Okay. We have ethical, moral dilemmas in our personal lives, in our family lives, in our work lives, and within the nursing profession. There's ethical dilemmas and ethical issues at every turn. And what is ethics about? Right? It's about doing good. Right? We are ethically responsible to be the best person we can, right? In nursing, provide the best competent care we can. To be the best parent we can, right? Ethics is about doing good. Okay, so ethics is critical in every part of our life. It's particularly critical in our nursing profession. Okay. Moral distress. Okay, moral distress is experienced when we as individuals are unable to act as we should be. Okay, moral distress is a burden for all nurses at some time or another. Okay, think about it. Your patient load is huge today. You don't know that you're going to be able to do everything you're supposed to do with every client. Right? End of life decisions could create moral distress for us. Patient load too high, like I just said, COVID visitor restrictions, patient die, when a patient's dying without any family. I mean, there's a gazillion examples of moral distress that we experience on a daily basis. There's some ethical principles to be aware of that guide us through our practice. Beneficence is the first one. It's down here. Beneficence requires that the nurse do good. Okay. Based on the scope of practice and the standards of care, we do the most good within the circumstances, right? Making sure our patients are comfortable, right? Their vital signs are done. Their food is, they're eating. You're doing their INO, whatever's ordered. Okay. That's the principle of beneficence. Okay. Making sure we're doing good for the client. Okay. Another principle is called non-malfeasance. And that requires that we do no harm. Okay, so the example we give is let's say you're cathing a patient and you contaminate the sterile field. What do?
You're gonna get a new one.
Go and get a new one. Do no harm,
Mhm.
right? I mean, we are obligated morally to do good and do no harm, right? Another principle is autonomy. We've touched on that a little bit today. Autonomy. What is that?
Allowing the patient to participate in their own care.
Absolutely. Autonomy, allowing the patient to participate in their own decision making, their own care. And then the last one, the last principle is called distributive justice. And it's exactly what it says it is, distributive justice. Whatever the resources we have, everybody should have access to those. Distributive justice. Right? Advocacy. Advocacy is important when we talk about ethics, right? Advocacy and nurse. I mean, as nurses, we advocate for everyone, don't we? Everybody comes to you, family, friends, right? You're kind of it, right? Advocacy in nursing practice. Okay. What is the best for our client? Let's talk about it as far as our nursing profession. Advocacy in nursing, we use the information and the resources we have. We're always trying to act in our patients' or clients' best interest. Maintaining confidentiality, meeting their needs. We do it with diligence and competence, right? Making sure the patient has received all the orders from the physician, those have been carried out, has all the information they need to make informed decisions. We're always an advocate for our patients, right? Sometimes sometimes we're in a situation where we don't have the ability to provide high quality nursing care due to our moral distress and ethical dilemmas. Has anybody been in that situation in the work setting? Yeah. Right? The one thing we can't do is abandon. Okay? So if you are unable to care, or here's an example. Let's say you're working in the home health environment, and maybe you're in a client's home and they're making unwanted sexual advances. Okay? Obviously, you go back and you talk to your manager, but if you're unable to care for the patient, there must be a transfer of care to another nurse. You just can't abandon. Another example, let's say you're assigned to a patient in the hospital and you learn that they just got transferred to the hospital from the jail and they're in jail for, let's say, murder. And you had a family member that may have been murdered in the past. And you just are morally unable to take care of that client. You know you're not going to be able to do good and do no harm. Does that make sense?
Yes.
Can't abandon. Got to get that client transferred to somebody else. Okay? So our duty with regards to ethics is to always provide the highest standard, the highest quality of care, using our ethical principles that we use all the time. We just don't know. You may not have known the formal name of it. We're always practicing, non-malfeasance and beneficence, trying to do good, trying to do no harm. Right? So ethics is very, very interesting discussion, interesting topic. Questions? So we covered a lot today. So I've opened up the quiz for you. It's, what is it, 10:05? Let's take about 15 minutes till about 10:20 to complete the quiz. And then we'll come back. Stay on camera, please. You got to stay on camera to do the quiz. and then we'll come back and we'll go through it. Okay? So go ahead and start that. I'm going to mute everybody. Okay? Okay, we've got about 3 more minutes. So if you're not finished, got about 3 more minutes, and then don't forget to hit submit. Is everybody done? Anybody still working on it? Okay. All right. If you guys, a few of you come back on camera, that'd be great. Thank you. Jasmine, come back on camera, please. Okay, let's go over this. I saw a lot of 9s and 10s, so that's great. Jasmine, are you around? Okay, let's go through this. School nurses engaging in primary prevention. Which intervention is appropriate? What's primary?
Prevention. This
Okay, so what's the correct answer?
discuss where and how to obtain ongoing contraception.
Alrighty. Okay, that's correct. What's C? Primary, secondary, or tertiary?
Tertiary.
Why?
Because they already have it.
Already have gonorrhea.
Exactly. What about D? What's D?
They're already pregnant.
You're
Yep.
already pregnant, so it's tertiary.
Yep. And what's A?
Screening for pregnancy.
Screening for
So,
pregnancy.
Secondary.
Exactly. So secondary. Yep. Yep. Good. All right. Which counseling is appropriate to provide a pregnant adolescent?
Using condoms.
Absolutely. Absolutely. Continue using condoms with every sexual contact. Okay. The other 3 are actually incorrect because we don't maintain a usual diet. We do not want prenatal care established in the second trimester. We want it in the first. And adoption decisions don't have to be made as early as possible. So the other 3 are actually incorrect. Which intervention should be prioritized? Important word, prioritized for a child who has witnessed a violent crime.
For mental health counseling.
Yes. The question, what's the important word in that question?
Referral.
Nope.
No, with violence, witness violence, violent
Nope.
crime.
Nope.
Prioritized.
Prioritize.
Prioritize,
Right.
right? This question is a good example of if you come upon a question that has more, that looks like it could have more than one right answer, and it's not a select all that apply, then you
Go back to
probably
the
missed
question.
something in the question.
Mm.
Right? You got to go back and read the question and was there a word I missed? Like prioritize or most important or first. Okay, so obtaining a referral for mental health counseling is the priority intervention. It's not that the other answers couldn't be correct, but it's asking you to prioritize. Okay? Which nursing intervention reflects secondary prevention for mental health?
For depression and anxiety.
Yeah. Well, screening gives it away. Should jump right out at you for screening.
Yeah.
Right? What is B?
Stress reduction technique to young children.
Right. What is that? Primary, secondary, or tertiary? Primary. Right? What about C? What's C?
Tertiary.
Why?
Because they already are depressed and on
They're already
antidepressants.
depressed.
Exactly. What about D? What's D?
Tertiary.
Tertiary.
Because they already have PTSD.
Yeah.
Which nursing assessment is most important in clients abusing oxy?
Apnea.
Yeah. This is a safety question. This is an ABC question. It's not that the others might not be present, but what is the most important? Okay, and that would be your apnea, right?
Mhm.
Which reflects tertiary prevention and substance abuse.
Arranging addict-led support groups to promote recovery.
Right. They already have the issue with regards to substance abuse. What is A?
Secondary.
Secondary. Screening, right? Screening. What about B? What's B?
Primary.
Primary is trying to prevent something before it happens. What about D?
Parent role model adaptive coping
Is that
mechanism.
also primary?
Should be
Mhm.
tertiary. Primary.
Primary. We're helping them. We're trying to teach them how to role model adaptive coping mechanisms.
Primary.
Which nursing intervention reflects non-malfeasance? What's non-malfeasance?
To
Do no harm.
Do no harm.
Mhm.
What's the answer?
Obtaining a urinary tract.
Right.
Okay.
Yeah, you've contaminated the field, right? If you continue using that, you may create an infection. That's doing harm. Okay. Hospice nurse notes that a client's pain is poorly controlled despite a fentanyl patch as needed, fentanyl patch and sublingual morphine as needed. Which intervention is appropriate?
Notify the healthcare provider.
Right. All the other three are totally inappropriate. Okay. We're not worried about addiction. We're not telling the family that a pain-free death should not be expected. And then we don't want to remove a fentanyl patch and put it back in the same location. So they're actually incorrect. The client tells the hospice nurse that I do not understand why God is punishing me. Which response is appropriate?
Do you have a pastor I can call for you? B.
That is the correct answer. Some students will pick D. Okay, what makes you think you're being punished? Because they think that the client wants to be acknowledged. at this point and in this current situation, asking that question makes them communicate maybe things that they don't want to communicate. Like if they did something wrong in the past that they feel like they're being punished for, we don't want them to have to bring up those memories. Does that make sense? Plus, this is a conversation that should be taking place if they would like a spiritual advisor. Okay? I do not understand why God is punishing me. Do you really feel comfortable addressing that subject? Do you have a pastor I can call for you? A pastor is much better equipped to handle that conversation. Does that make sense?
Yeah.
Okay. And then question 10, client with metastatic cancer has made the decision to stop all therapies. Which statement by the nurse reflects a respect for the client's autonomy?
Yeah.
Would you like me to help you sharing of news to the family?
Exactly. Right. The other 3 are going against the client's wishes, right? They don't want to hear about radiation. They don't want to hear from you if you feel like that's the best decision or not. And they don't want any more treatments. Okay. So good job. Good job on these. We covered a lot today. So take this information and go back and try and fill out your HESI prep. Get that going. I would gather probably half of it. Half of it can be completed by now. So questions?
Yeah, as far as like the nursing guidelines for the HESI prep,
Okay.
How much
So-
like are you looking for in there?
I'm just looking for a couple of sentences. I'm looking for the big picture. How would you treat a patient that came in with potential anthrax exposure? What might they present with?
Okay.
Right? How is it treated? It's for this is for your own studying purposes. So if you need to write a lot in there, that's fine. But I'm looking for a basic understanding of what each box is. Because remember, you're creating your own study guide for HESI. So as much or as little as you want to put in there, but this is education for you. If there are things in there you want to put in, I'll forget about that. I'm just going to put that in there, put it in there. But think nursing process. So how would you assess a client with, I'm just using the first section. How would you assess a client with Ebola? What symptoms might they come with? How do you diagnose it? How do you treat it? Just thinking through the nursing process. There's no particular way other than your comfort level of thinking through the nursing process with each box and how you would like to remember it, because this is what your study guide is going to be. Does that make sense?
Yes.
So you can make it as least complicated as you want or more complicated. I mean, there are students that write 2, 3, 4 paragraphs in each box. You know, I'm looking that you've completed each box and you've thought about the nursing process. Okay. All right. I hope you guys have a good weekend. Good to see everybody today, and you know where to reach me. As far as exam 1, I do have lots of tutoring set up this week and next week. So if you do want to get together with me and you haven't scheduled anything yet, I would really encourage for people that score below a 78 to reach out to me to review the exam or review the concepts missed. It really does help to go through the exam, because not only we find the content that you missed, but we can usually figure out test taking strategies that may be helpful. So it's up to you. Anybody that got over 78, I'm happy to meet with you guys. Okay. I met with a student earlier in the week that was in the 90s, and she wanted to know the 2 or 3 questions she got wrong. So I'm happy to meet. That invitation is open to everybody. Okay. And don't
Thank
forget
you.
go ahead. What?
I just said thank you.
Oh, you're welcome. You're welcome. And then don't forget to look at the review sessions coming up next week. See if you can maybe prioritize getting to one. I know you guys are busy with work and school and family. I get that. Just take a look and see if there's any way you can try and get to one live. And as I do every term, there's a significant, you can see the difference in exam scores of people that attend live reviews. It's factual. So do what you can. You'll have 3 opportunities for a live review, and then I'll send you all 3 recordings. So you'll have all 3 recordings to watch as well. Okay? All right. Have a great weekend.
Have a nice weekend.
All right. Thanks. You too. Bye.
Thanks. Bye.
Bye.